Hi, my name is Cheryl Carpio, and today I'll be performing an IV fluids and medication administration. I have checked the doctor's order, verified that the patient is not allergic to the medication. I have gathered all my supplies. I have my alcohol prep. I have my pair of gloves. I have my 2 sets of tubing. I have the administration tubing as well as my secondary tubing. Both are Macrodip 15 drops per ml. I have my solution as well as my medication. I have performed hand hygienes. I have also done my calculation. So our fluid is 150 mLs over 60 at 15 drops over a minute. That gives us at 37.5. We rounded to the nearest 10. That gives us 38 drops per minute. And then our medication, amoxicillin, is at 100 mLs over 15 minutes at 15 drops over a ml. That gives us 100 drops per minute. All right. So I have washed my hand, performed hand hygiene. I've gone to the patient room. I knock. I introduce myself. I let them know who I am. I'm here to give their medication as ordered. I ask them to verify their name and date of birth. They tell me their name and date of birth. I verify it with their wristband. I check in again with them if they have any allergy. They have no known allergy. I have performed my 6 rights, 6 medication rights, and that is right patient, right medication, right dose, right time, right route, as well as right documentation. All right, so let's get ready and set up. So I'm gonna put on my gloves. I'm gonna take my administration tubing. All right. So we have our spike right here. It's covered, it's sterile. And then we have our chamber here. We're gonna fill it halfway. This is where we're gonna be also controlling the drift factor. We have our roller clamp. We wanna make sure that that is closed. We have our tubing. We have our Y port that we're going to connect our secondary line to and our medication, and then our adapter, the end, which gets connected to the patient's IV. All right, so let's get started. So I'm going to take the solutions. Take that cover off. Take the cover off the spike. And then I'm gonna invert the bag and go ahead and spike it. All right. And then we're gonna go ahead and hang that. And we wanna make sure that our bags are 36 inches above from the IV site. So we're gonna go ahead, fill this up halfway. And then we're gonna prime it, make sure there's no bubbles in the line. Okay, see a little bit more bubbles. All right. Okay, so now there's no air in the line. So now I'm gonna go ahead and set our drop rate to 38 drops per minute, okay? So we're gonna go ahead and do that for, count for a full minute. All right. So now that is set, we're just gonna set it aside. And then we're gonna go ahead and set up our second bag. We have our secondary tubing, same thing. We have our spike, the chamber, the roller clamp, and then this will go into the white port. So make sure that the roller clamp is closed. All right. So this bag will be going higher than our main solution. And like I said, we want to make sure that this is about 36 inches above the IV side. So we're going to go ahead and hang this. And the same thing, fill the chamber halfway. And then we're going to prime the line. Okay. Okay, now our line is prime. Now we're going to set our drip factor to 100 drops a minute. So we're going to count for a full minute. All right, so now that it's set, we're going to go ahead and close it. We're going to take our alcohol swab and we're going to clean the white port. Okay, so now that's all set. It's hooked up to our patient's IV line. You want to make sure that everything is going okay. We should have checked the IV site first to make sure there was no redness, bulvitis, no swollen or none of that before we hooked up our line. But I also have a label here, which I'm going to put on our bag. It has the patient's name, the drugs, the amount, the rate, the time we started, as well as the flow, okay? Okay. So we also want to stay for a little bit just to make sure that the patient is not having any kind of reaction or any anaphylactic reaction to the medications. So once I'm done, make sure patient is comfortable. I have removed my gloves, perform hand hygienes, and go document what I just did. Thank you.